This is Libertarian Viewpoint, and I'm your host, Sue Jeffers. We have all heard the constant drum roll of government solutions. The purpose of this show is to present you, the viewer, the non-government solution. Knowing non-government solutions will help you to ask more informed questions when you're talking with government officials. Libertarianism is about liberty. Liberty is the exercise of freedom that doesn't impinge on the rights of others. It's hard to see how anyone could be against liberty. All non-government solutions are based on liberty. Today, we have Twila Brase from Citizens Council for Health Freedom discussing all things healthcare. Thanks for being with us, Twila.
You're welcome.
Tell us, what got you involved in healthcare issues?
Well, that's a big question.
Yes, it is.
I'm a nurse, and I started to see that President Clinton and Hillary wanted to take over the healthcare system, and I understood that to be an expansion of government power and an end of liberty, not just in healthcare, not just healthcare freedom, but in liberty for all of us. Because once they have you, once they have your health, once they control whether or not you get access to care or medicine, they really control your life. So I saw that as a threat to liberty, nationwide, issue-wide, whatever, that we had to deal with the healthcare issue and keep freedom there in order to keep freedom for us all.
So we managed to stop Clinton care, or universal health care, the Clinton version.
Right.
But now we have Obamacare.
Well, yes, we managed to stop the really big plan of Clinton care, but they had what they called option 1 and option 2 and option 3. And so option 1 was what we all heard about, but option 2 and 3 were called kid care. And kid care was the implementation of Medicaid into all the children. So it was essentially the expansion of Medicaid into the middle class, starting with the children and going towards their parents, and that happened in 1997. And there are other pieces of Clinton care that happened in 1996 and 1999. So we stopped Clinton care, sort of, but not for the long haul. And then now we have Obamacare, and Obamacare is truly a government health care system. You can truly see the federal imposition of power that will happen at the state level coming through the federal government. And so we have a tough road, and hopefully the U.S. Supreme Court will rule that it is unconstitutional. But as you know, nobody knows yet what's going to happen.
And we're a year away from that happening.
At least a year.
Right. Yep. 26 states believe it's unconstitutional.
Right, 26 states, and then there are others, states like Minnesota, who have put a sort of an amicus brief together to help support those 26 states who are part of the lawsuit. Because Minnesota can't join the lawsuit because the Attorney General won't do it, the governor won't do it, but certain legislators sent an amicus brief, a long list of them, to join with the federal, with the Florida lawsuit with the 26 states.
Yes, I'm looking forward to that. And if we can't, if it isn't overturned as unconstitutional, we need to repeal it, plain and simple. Every single page of the 2,700 pages.
Yep, there should be no doubt that it should be a very simple bill. It only needs to be one page, which says that the whole thing is repealed. No complicated stuff about going into there and saving this and getting rid of that. It should be just a complete, straight-out repeal. And then we can start working at bringing freedom back to healthcare, because today we do not have freedom in healthcare. I mean, Obamacare is bad, but we don't have freedom because of Medicare and Medicaid, and particularly because of particularly because of Medicare. Medicare sort of shows everybody how the government has already a single-payer healthcare system for the elderly. And a lot of the elderly don't understand that, number one, they have to go into Medicare or they lose their Social Security. That's certainly not about freedom.
That is not about freedom.
No, and the second thing is that if Medicare decides that a covered service, so one of the services that's on the list of benefits, but they decide that that covered service, you're not eligible for it, then the law says that the patient cannot pay the doctor. for that service, which means that a senior citizen could be out of the very thing that they need to survive. Just because Medicare says no, and because Congress decided that the money of seniors is not good after age 65 if Medicare has said no to something.
What steps do you think we should take to start turning this Titanic around?
It is a Titanic, isn't it?
Yes, it is.
Yep. But and I think the collision with the iceberg is coming. We're seeing all the little pieces of ice floating around the boat, but the big iceberg is coming, particularly with Medicare, where just I think it was a week or two ago, the Medicare trustees cut down the number of years for which Medicare will be solvent. So now it's only until 2024 rather than 2029. And they did that in 1 year. So if they cut it down another 5 years next year, I mean, we're looking at a Titanic here for all those seniors. And seniors, there's about 44 million seniors in Medicare today, but there's 77 million baby boomers that'll start entering Medicare next year. And so this is why it's not solvent. So we are definitely hitting a Titanic. Well, I think there are several things that we should be looking at. All of them should be free market. All of them should be using our own cash and being able to have the power that cash provides for us. And so some of those things that need to happen, I think, related to Obamacare, we'll just look at Obamacare first, is that no state should be a party to implementing the federal law. So there should be no state that sets up an exchange, which has been a battle at the legislature this year.
Here in the state of Minnesota, and we should tell people, Twila, that was a battle you and I fought back in 07 and 08.
Yep.
And
yep.
we stopped it then,
yep.
and here it is back again, and we're just going to have to keep fighting until we stop a Minnesota version of the health insurance exchange. People don't realize that they call it a Minnesota health insurance exchange. It's not a Minnesota health insurance exchange. It gives all the power to the feds.
That's right. The idea of calling it a Minnesota health insurance exchange is to make it seem like it's a state entity. And if the Republicans put it in like it's a Republican-placed state entity, but it's not. There's only one exchange by federal law, and it's called the American Health Benefit Exchange. And that's the only kind of exchange there is. It must follow every law, every rule that the feds put out. So to impose it on Minnesota with a Minnesota name or by the Republicans or to call it a state is all a part of a deception to make the public not realize that that's really an imposition of federal power over all healthcare things or all healthcare within the state of Minnesota.
Health insurance exchange, because Mark Dayton wants one, and I'm just really troubled that may be part of the Let's Make a Deal package.
Right. Mark Dayton wants one. Governor Dayton wants one. The Democrats want it and had bills for it, and House Republicans, certain House Republicans want it as well. But the good thing after our efforts this year, and you've done some work on that too, is that I believe 6 Republicans have dropped off of the bill. So he has significantly cut the co-authors, or there's fewer co-authors than there were before.